Hello everyone, my name is Dr. Bukhari. I'm a practicing physician in the state of Illinois. Today we will discuss about a commonly used NSAID and commonly prescribed NSAID, which is called ibuprofen. So let's start. So we will start with mechanism of action of ibuprofen. Ibuprofen basically inhibit COX-1 and COX-2 enzyme, which will result in decreased formation of prostaglandin. And as the prostaglandin decrease, it will result in decreased inflammation. It also decreases inflammation by decreasing chemotaxis. It inhibits neutrophil aggregation. It inhibits neutrophil aggregation and also decreases pro-inflammatory cytokines. And all these processes will result in decreased inflammation, decreased pain, decreased fever. Now the onset of action of ibuprofen is in about 30 to 60 minutes. It reaches its maximum effect in 2 to 4 hours, and the duration of action is about 6 to 8 hours. Ibuprofen is mainly metabolized in the liver. Now, what are the common uses of ibuprofen? So number one is it is used as anti-inflammatory medication. Example, it is commonly used in arthritic pain of rheumatoid arthritis and gout. So for anti-inflammatory effect, the dose which is commonly used by different physicians is about 400 to 800 milligram in every 6 to 8 hours. And the maximum dose recommended is it should not be more than 3.2 gram per day. If it is a pain of gout, the medication should be used within 24 to 48 hours after the onset of symptoms. The treatment of gout lasts for about 5 to 7 days. The second common use is it is used as analgesic medication to control pain. In the hospital, it can be used as IV. As outpatient, it can be used as oral medication. And the dose, depending on the patient pain, can be ranged from 200 to 400 milligram every 4 to 6 hours. And again, the dose should not exceed 3.2 gram per day. It can be used as a medication to decrease fever, antipyretic to control fever. We'll give this medication 200 to 400 milligram every 4 to 6 hours. And if the fever continues, you can increase the dose. The next side effect, the next use of ibuprofen is it can be used in dysmenorrhea. Dysmenorrhea or abnormal uterine bleeding. You can use the dose 400 milligram every 4 hours PRN as needed. The next side effect is it can be used for the treatment of pericarditis, acute pericarditis. And it is usually used in a taper dose. So you can use 600 to 800 milligram every 8 hours. And then you can use it for first 1 to 2 weeks. And after that, you start taper it down. So the taper dose will be 200 to 400 milligram for 1 to 2 weeks. So the idea is to taper the dose in acute pericarditis. Sometimes it can also be used in migraine as a single dose. So this is a mechanism and the uses of commonly used medication known as ibuprofen, which is an NSAID. Besides the common use of NSAID, we have to be very, very careful and keep in mind about the side effects of NSAID medication. So we should always keep in mind that NSAID can have a lot of side effects also. So the first side effect will start with GI side effects. So NSAID can cause GI bleed, peptic ulcer disease, and sometimes even perforation. What is the mechanism? So ibuprofen basically inhibit COX-1 enzyme, which will result in decreased production of prostaglandin E2, which is forming the protective lining of the stomach. And then prostaglandin E2 decrease, the GI side effects will happen. These side effects happen if you use ibuprofen for more than 7 days. So that increases the risk. The other side effects which can happen with ibuprofen related to GI is it can cause abdominal cramps, abdominal distress, abdominal pain, and constipation can happen. Now, who are the patients who are at risk of developing GI side effects? Old patient, greater than 65 years of age. If you use high dose of medication, if you use longer duration of this medication, greater than 7 days, if your patient has a history of peptic ulcer disease or inflammatory bowel disease, they are at high risk. The patient with advanced kidney disease or advanced liver disease. The patient who are taking aspirin, antiplatelet or anticoagulation medication. Smoker, patient who are smoker or who uses alcohol are at risk. The second side effect, it can affect the liver. It can cause Hepatic side effect. It can cause elevation of AST and ALT. The exact mechanism of this side effect is not clear. The next side effect is it can affect the kidney. It can cause AKI, secondary to acute interstitial nephritis. It can lead to papillary necrosis. What is the mechanism? So it inhibits COX-1 and COX-2, which results in decreased production of prostaglandin in the kidney, which will decrease vasodilation in the kidney, resulting in AKI. The patient who are at risk, who have CKD or greater than 65 years of age, they are at risk of developing kidney disease from ibuprofen. The next side effect is, what are the heart-related side effects? Cardiac side effect of ibuprofen. It increases the risk of MI, coronary artery disease, hypertension, and CHF. What is the mechanism? It inhibits COX-2 enzyme, which will result in decreased prostacyclin. So which will result in vasoconstriction. What are the patients who are at risk? The patient who has a history of coronary artery disease, hypertension, diabetes. So these are the patients at risk. It can exacerbate CHF because it can result in fluid retention. Ibuprofen NSAID sometimes can cause fluid retention. The next side effect is, what are the hematological side effects? So ibuprofen can cause aplastic anemia, leukopenia, thrombocytopenia. So it can increase bleeding time by decreasing prostaglandin and thromboxane A2. So that will result in decreased platelet adhesion and decreased platelet aggregation, which will increase bleeding time. Ibuprofen can also cause hypersensitivity reaction. Allergies can happen, angioedema, anaphylaxis. In newborn, when we use ibuprofen, it can cause pulmonary hypertension initially when patent ductus arteriosus close. It can cause CNS side effects like dizziness, lightheadedness, blurring of vision, headache. NSAID can cause, ibuprofen can cause hyperkalemia. Potassium level can go up, especially in patients who have CKD. So these are some common side effects caused by ibuprofen, and we should remember all of them because this is a commonly prescribed medication in inpatient and outpatient setting. Now, what are the contraindications? What are the contraindications we should keep in mind when we are using ibuprofen or what are the warning? What are the things to keep in mind when we are prescribing ibuprofen? We should be careful to use ibuprofen in patient who has elevated potassium. We should be careful with ibuprofen in patient with asthma because this drug can cause bronchospasm. The patient who has liver failure or hepatic impairment, we should avoid this drug. The patient who has kidney failure or chronic kidney disease, we should try to avoid this drug if possible. The patient who has a history of coronary artery disease, we should be cautious using this drug. The patient who has neutropenia or thrombocytopenia from any cause, we should be cautious using this drug. So these are the warnings we should keep in mind when we are using ibuprofen in our patients. Thank you very much and have a nice day.